Okay, so it's summer and you're doing some air travel, but let's say on your last flight that you had some air pressure. It didn't seem to pop very well. You descended, couldn't clear, you land. Sure enough, it's muffled, a little pain, pressure. So you've had some barotrauma. So let's talk about that and what you can do to treat it. So first, if you remember anatomy, you've got the Eustachian tube that connects the back of your nose to the space underneath your eardrum called the middle ear space. Its job is to open and close multiple times a day. And again, keep that pressure under here the same as the outside world. So if this is swollen for any reason, a head cold or allergies, it may not let that pressure equalize as well, and you can have problems, especially during air travel on the descent. You've got a lower pressure that's under the drum, a higher pressure in the cabin, and if it can't get up that Eustachian tube, then you actually land with a vacuum under here, and that's what we call barotrauma. You can actually get fluid in that space and blood sometimes as well. So let's say that it's happened. What can you do about it? There's kind of three things that we would talk about. First are the decongestants. Ideally, you would have done that before the flight. So we're playing some catch up, but they can be helpful. So that's the Sudafed to take multiple times a day. And then the topical Afrin nasal spray that you can spray in your nose a couple times a day for no more than 3 days, we say. That'll hopefully help decongest your nose and the Eustachian tubes and help them open a little bit more easily. The second thing is to force the issue a little bit. We call that the Valsalva. So if you pinch your nose and try to blow out of your closed nose, we call that the Valsalva. Pushes some air up against the Eustachian tube. Hopefully can sneak a little air inside. If not, you can transition it to a swallow. That can be helpful. And then the third thing are supportive measures, honestly kind of pain control. It's taking ibuprofen, it's taking Tylenol, it's using a heating pad multiple times a day, doing things to help you swallow more like, chewing gum. Those can be helpful as well. So how long does it last if you have it? Most mild cases typically start to improve 2-3 days is what's been found. Studies do suggest that full resolution, though, can take a week or even a little bit longer than that. So that suggests that some are even longer than that. So it is important to be patient when you have it. Red flags, things that you should seek attention for. Any drainage, pain that's not controlled by ibuprofen or Tylenol, spinning, vertigo, or dizziness, not normal, or a complete hearing loss, maybe with or without ringing. We consider that an emergency in the ENT world. Would be good to seek care if you saw that. So again, barotrauma, fairly common with flying, especially if you have a head cold or really severe allergies. Most will kind of clear on their own, again, with conservative measures, decongestants, trying to pop your ears. Keep an eye out for those more maybe scary problems, the sudden hearing loss, the severe pain, the spinning, vertigo, or drainage. That'd be a time to visit with your local Instacare or ENT. Now you knows, follow for more.